Welcome to the Sykes & Company PA video blog featuring Ollin Sykes.
What's your best advice for someone who wants to buy a pharmacy in 2016?
Well, if somebody is interested in buying a pharmacy, the first thing they need to get hold of is to identify a potential candidate. Probably going to be a boomer. Probably going to be somebody that may or may not be set up for exit, which could work to your advantage if you're the buyer. You probably want to sign a non-disclosure agreement, which allows you to exchange information back and forth in a confidential way. You'll definitely need to get tax returns and the full QuickBooks file. They're probably running QuickBooks for the last 4 years. You need to provide that information to somebody like ourselves who can scrub that data and information and be able to identify the strengths and the weaknesses in the accounting system, in the tax issues that they may have. You clearly want to get hold of the script dispensing logs and summaries from the last 3 or 4 years. Look at the trends. That's very important data with respect to community pharmacy. You want to understand exactly what the pharmacy is doing, i.e., are they in long-term care? Do they have contracts? Are they in compounding? What percentage of their business is compounding make up, or does long-term care make up? Or are they in DME or home health care? All these ancillary sides of the pharmacy are very important in trying to determine what a fair value is for that pharmacy.
Should I have a sense for how big of a pharmacy I can afford? Should I be looking about financing before I find the pharmacy, or is that determined by the health of the pharmacy I'm looking at?
That's a really good question. I will tell you, my experience is you want to buy the biggest, most profitable pharmacy you can. And you might be listening to this and saying, well, how in the heck can I do that? I don't have but $10,000. Look, I'm going to tell you, I have seen a pharmacy that had retail sales in the last 2 years of $6 million being sold to a new pharmacist that had $25,000 cash and had about a 750 FICO credit score, and whose student loans were not in arrears. Those are the key factors. If you got limited cash, good credit score, your student loans are not in arrears, then you've got all kinds of opportunities through these major financing arms that are out there, who both tie in with SBA, and I'm talking of Live Oak Bank and First Financial. Live Oak Bank is the primary one that's involved in these kinds of things, but they have connections with the SBA through the 7A program for you to purchase these pharmacies with limited cash. The larger the pharmacy you have, the more profitable that pharmacy is, the more you pay for it, the better off you're going to be in a 3 to 5 year period versus thinking, I'm going to go out here on my corner in my hometown because I think there's a good location and start up a pharmacy and take $500,000. That's what it's going to take probably to get profitable in the first 18 months, and you may not be profitable in 18 months. You're far better off taking on that debt, leveraging yourself, running it properly. You're far better off doing it like that. Studies have shown. There are opportunities all over the place. There really are. You just have to find them. You have to network with people. You've got to go to these conferences. You've got to go to these trade shows. You've got to keep your ear open. You've got to talk with the buying groups. You've got to talk with the wholesalers. Last resort, maybe you want to talk with a broker, but a broker is only interested in it's going to make a commission if a transaction is sold, and that may or may not be in your best interest, so you have to be careful with that. But there are many people out in the industry that can help you, whether it's the NCPA or some of these others that I've mentioned.
Thank you for joining us today. If you want more information or have any questions, please feel free to contact Ollin directly.